So it is 7:01. Shall we begin? John, you're muted. Are you, assume you're there.
Oh, sorry
Good.
about that.
Great. Hi.
There.
All right, everybody. Shall we begin?
Yes.
Um, uh, this is the February 2nd, 2026 meeting of the Board of Health. Let's begin with a roll call. Kay Peterson, Chair, present.
Stephen Kruskall, member present.
John Quackenbush, also member, also present.
And the other people here are our Health Director, Jason Belmonte, the Public Health Nurse, Gail Varsa, and Sophia Kriesman, our Administrative Assistant, who is running the show here. Do we have any visitors to the meeting?
We do not.
Okay, so therefore, we have no citizen comments to listen to, and so we'll move on to just our schedule for our next meeting, and then we'll do our minutes from the last. So March 2nd, does that look good for everyone?
Yes.
The caucus is that night, the town caucus?
Then no.
Then no.
That makes it easy.
All right, so shall we try to postpone 1 week to the 9th?
There's the Dover annual town election that day, but that's fine with me. Yes.
Are you sure you have that date right?
I don't know.
Because it seems to me that election is a lot farther after the caucus than a week.
Okay. I
In
probably
fact,
have it wrong then.
the election is after town meeting. Town meeting is early May, and then I bet it's the election's the second or third Monday in May, something like that.
All right.
So shall we shoot for the 9th? Is that good for the rest of you?
Yeah, I think that works.
Okay. All right. Let's move on to the minutes from our last meeting, January 5th. Um, are there any questions about the minutes? Any suggestions for edits? Steve? John's
Fine.
not, no, they're fine with me. Sophia, you write so well. Yes.
They
Thank
are
you.
very nice.
Um, and I thought you summed up things very concisely and got the points that we made. So um, I'll entertain a motion to approve the minutes.
I move we approve the minutes.
Second.
All in favor? Aye, Kay Peterson.
Hi, John Quackenbush.
I, Stephen Kruskall.
Okay, great. All right, so let's turn to Gail for her report.
Sophia, do you want to bring up the flu slides?
Sure.
So,
All right, I'll share my screen. Gail shared a couple slides with me earlier this morning that she wanted me to share. So give me 1 second.
thank you.
Okay, can you see my screen?
Yes.
Yep.
Okay.
So, Needham put this together and we went over their numbers in that shared services meeting this morning. It just highlights the flu numbers, December into January, and we are starting to see a little bit of a decline from perhaps a peak. I can't say for sure. But the numbers were striking. Needham with 181 confirmed flu cases in December and over 100 in January. Dover's numbers were impressive too.
Oh, I'm sorry, go ahead.
So in the past, week, I've only had one Dover flu case. And again, these are just reported numbers in Maven. It is not the complete picture if people are voluntarily testing at home or staying at home. So the numbers are probably higher. The next slide will show COVID numbers, confirmed COVID cases, a little higher in January for Needham, Dover numbers, and Sherburne. We do have test kits that shared services purchased for the towns. Dover got 25 test kits, some which test for both flu and COVID. So we have a number of them in the Board of Health, and I shared some of them with the COA too. Since, as you know, the state does not give us any more flu kits for testing, but those are for, we've given out a couple in the Board of Health, one to an employee and one to a resident. So fingers crossed the numbers are coming down, but we're still in high respiratory virus season for sure, with everything else going around too. So, any questions? Kay, did you want to comment?
No. Oh, well, actually, I was just curious, what's the population of Medfield? Is it substantially higher than Dover's?
Yes, about 14, I believe.
Uh-huh.
But could we have these numbers presented to us in a per capita fashion in the future?
Sure, I can do that. These are just the raw numbers. And again, you know, the per capita will just show these are only confirmed cases that are reported through the state. The
Yeah.
numbers will probably be higher. I know from the schools that they had kids out, but it wasn't anything unusually high in the schools.
Mm-hmm. So they didn't have to close any classrooms or anything like that?
No, nothing like that.
Didn't have that many absences. Good.
You know, in the MIIS report, which shows the population coverage for vaccines,
Yeah.
you know, all the towns really, you know, the most vaccinated population were newborns to 6 months. And probably one of the lower ones were ages 18 to 49 for flu vaccines. But even in the 65 and over, MIIS reports less than 50% vaccinated.
Is
Wow.
that both for COVID and flu?
Just flu.
That's
Are there
unfortunate.
I'm sorry.
That's unfortunate.
Yep. But it's significant to consider though too.
Now you talk about the fact that it's pretty clear that there are some providers around the state that aren't necessarily getting their data into MIIS. I remember you saying that.
Right. And the only way I would know that is if I was to speak with a resident who said, you know, I've had the flu shot, I got it at my doctor's office, but I can't see it in MIIS. But I mean, by law, people have to report vaccines in MIIS.
Yeah. So, do you know what the are there municipalities around the state that have significantly higher flu vaccination rates among 65 and older? Do you know?
I would have to look into that and see.
It'd be interesting to know whether.
Would you be interested in these 4 towns?
Yeah.
3 other towns in shared services?
Yes. And also just a sense of, you know, what's achievable, what's sort of the benchmark that we might be comparing ourselves, or benchmark's not the right word, but
Standard.
I mean, do you think any sense of from your interactions with people in town, whether it's general vaccine hesitancy or some other issue that's depressed the numbers this year?
I think it's
Hesitancy,
Pardon me?
hesitancy.
I think it's
Yeah.
fatigue too.
Yeah. I've spoken to a few people who are townspeople and who haven't gotten them yet, and I've spoken to them multiple times because they all should. And there certainly is hesitancy out there amongst older people now.
You know, the way I've tried to pitch it to people around the hesitancy is you don't want to be in a position where you're going to need a higher level of care or in an emergency room, because that's the last place you want to go these days. A couple of weeks ago, we had a presentation from Newton Wellesley about ER access. And, you know, during the peak month, late December into early January, they were overflowing with flu cases. And a lot of them were older residents from the surrounding towns that had multiple comorbids. And you just don't want to be in that position where it's going to be a full court press to, you know, take care of people and be on a stretcher in an emergency room waiting for a bed. But I think what I have encountered talking to people is not going to happen to me. I'll deal with it when it happens. So, all ages.
Yeah. Have you heard anecdotally, have any of you heard anecdotally about anyone in our town who's become seriously ill with flu this winter?
Oh,
I haven't either, but I wouldn't probably. Well, they're low probability events, and so people don't necessarily hear about it, and it doesn't alarm them enough to motivate them sometimes to do something.
I think because the vaccines were released late too, the formulas.
Yeah.
I think there was just so many mixed messages out there. People were just tired of hearing about it too. I know some people think, am I too late getting it? It's not too late.
Yeah.
I think, is this a good time, Jason, to talk about the banner too? Because we wanted to do something to alert people about the flu.
Yeah, I mean, it is a separate agenda item, but if you'll allow that, Kay,
Yeah, that's fine. I think it'd be
we can
great
talk
to
about that.
move to that.
Well, you know,
I'm-
to Steve's point too about, sorry, Gail, getting the numbers normalized by population. It'd be interesting to see what the trend is given between last year and this year. You know, it's a different flu strain, but also with different towns and the actual rate of infection, what that looks like too. It may not, I mean, 4 towns is probably not enough to really see any trends,
Mhm.
but it'd be sort of interesting just to see what that looks like.
Well, it was interesting looking at the raw data that you showed that don't we have just about as many cases as Medfield?
Yeah.
Yeah.
And yet Medfield has slightly more than twice the population. But you know, the data reflect also who goes where and who gets a test and who doesn't get a test, and
Yep.
whether they test at home. And you know, it's so there.
Well, it's not just in community transmission either, right? We're living in
Right.
Massachusetts and people are
Yeah.
traveling to Boston.
Yep.
And so Gail mentioned too, by the way, so we do have a few COVID test kits in the office. And when I say a few, I mean, what are we talking at this point, Gail? We probably have less than 10.
Yeah, around 10. Yeah.
Yeah, so it wasn't one of those things we were going to advertise or put out there, just kind of keeping those reserved for the one-off folks who come into the office. kind of in desperate need. That's kind of what I envision for those. So we have that very limited supply for those who need it. We started with 2 dozen, and right off the bat, Gail just gave half to the COA just because we felt, that population, of course, is the most in need on that front. So really only have a couple of those. So not really something we're putting out there.
Sounds good. I think that shared services paid for them out of funds that were left over from the pandemic.
Yes.
They didn't come out of the annual budget of the shared services program because they don't have funding for
Right.
test kits, but they were
Yeah, it was kind of unexpected actually. There
Yeah.
was it last week, Gail, where all of a sudden
Yes.
one day you said I'm going to pick up test kits?
Yeah.
I mean, it was a nice surprise.
Yeah, hey, we'll take it.
Gail, do you have a sense that once we're able to give vaccines, that you're able to give vaccines in town, that will make a difference for some people?
I hope so. We can advertise it and just make it easy for as many people as we can. I mean, the turnout last fall was my first experience with the clinic in Dover. It was about 90 people, but I'm hopeful.
Yeah. Do you think that at encounters like, say, blood pressure readings, that might be an opportunity to give people another shot at it? No pun intended, but if you were able to give somebody a vaccine at the time they came in for
I
their
think
blood pressure?
ideally I'd like to keep those separate and just say, by the way, if you have time afterwards, come back to the office and get a flu shot, rather than try to balance both demands. The blood pressure clinics, and while you're bringing it, is getting a lot of interest in Dover. And because of the concern about stroke, a lot of people are on medications. Medications are being switched around. There's been a lot of interest.
Good.
It's great. And
By the way, you're frozen. I don't know if you need to do anything. We can hear you, but you're
okay. Yeah,
just
it does this. But
so
and
can I go back to well, we shouldn't get too much distracted by the blood pressure right now. We should stay on track about the flu vaccine.
so the banner was
Yeah, the
a
banner.
question too. I know that had been raised. There's a ton of snow out front now in front of town hall, so there are no banners out there. And I don't know how you feel about putting something out later in the winter. I do feel that just to focus on flu, I think a banner that covers all respiratory viruses and just alerting the general public that it's respiratory virus season, illness season, reminders about hand washing, vaccines would be beneficial. And I just wanted to see how people felt about that.
I think it makes sense. I mean,
I think it's a very good idea.
Yeah, so if you guys remember too, this was something I'd reached out to everyone a few weeks back. Maxie drafted a banner design for us. I sent it to you guys for feedback. The issue we kind of ran into was I couldn't get a consensus from the group on what we wanted to move forward with, so we never ended up ordering one. And like Gail said, anyway, I mean, I don't know if you guys. I'm sure you've all been through the center the past few days, but the banners are buried by snow at the moment. So even if we had ordered it, I mean, they would have been covered anyway. But anyway, that's besides the point, I suppose. I guess what we're trying to figure out is I just want to make sure we're all in agreement on this messaging so we can order something and move on, before we're past respiratory season here, if you will.
So I love the idea of having a banner that isn't specific to any one year that we can bring out again and again, assuming that what we want to say in our message isn't changed. And I also like the idea of addressing all of the three big respiratory viruses that at least some people should be immunized against. But I guess that's really the first question. Do we want it to address all, or do we want it to just address flu? What do you think, John and Steve?
I think it was a good idea to have it, flu, COVID, RSV, right? A lot of the preventive measures are basically the same, right?
Just the vaccine acceptance is different in all three, and in terms of incidence, that's quite different too. And flu always seems to be predominant, with the exception of the COVID years.
Hmm.
And therefore, this year I would certainly be influencing flu. I want flu to be mentioned strongly, because there's probably still a few more weeks to go in the season, and people might benefit. I'm not so sure they're going to benefit a bunch from a COVID shot right now, or an RSV shot.
Right. But, we could use this year after year if we have a good one, right? Get vaccinated, wash your hands, you know. It's pretty common sense stuff, but I think it's good to remind people.
Yeah, and I think just because COVID and RSV uptake is not so high, doesn't mean we shouldn't be promoting them. And
Yeah.
I guess the one thing I'll add to is so we have a draft right now that we've put together, our most up to date draft. It has a lot of good information on it. And I don't know if Gail can hear us, but maybe Sophia can bring up the draft if you'd like to see it, if that's what Gail wants.
Gail, can you
Um,
hear us? Gail, are you able to hear us?
But so anyway, I guess what I was getting at is you don't
She
want it
put
to be too
a
wordy.
comment in the chat that she lost audio. So
Yeah.
sorry, Jason.
No, no worries. No, I was just saying, you don't want it to be too wordy. I mean, think about it. You're sitting at the stoplight there for, I don't know, 45 seconds.
Less.
Less, thank you. You need to actually be able to get a visual, and whatever information you're trying to get across, you need to make sure you deliver it effectively. So whatever language we want to be on there, we just want to make sure we're short and concise.
How about Burma shave signs?
Sophia probably has no idea what those are.
Jason, do you have any idea what that is?
I don't. I just laugh to be part of the group.
So I don't even know. I mean, this is from my childhood. I don't know. What's the context, Steve? Somehow I see-
1940s, it was an advertising campaign that extended into the 50s, with consecutive space signs along roadways, perhaps 100 yards
Mm.
separation each one. And it was a message which ended with "Get Burma Shave," which was a product then of similar to other shaving creams that have succeeded it. But it was iconic. It's part of American highway history.
Yeah, the history and culture.
Um,
You see it in old movies, so.
Yeah.
yeah.
Maybe we just
So-
maybe we just need like a bat signal where we can just beam the messaging up straight to the sky.
That sounds good. A hologram on the side of the town hall.
Well, you can do it from the transfer station where they have the solar panels. Make it easy.
Well, the question is what's the most concise, important message? And how do we decide? The banner that we could show the banner right now that she designed. Did you all see it, Steve and John?
I can't find it, so I don't know if I saw
Do you
it.
guys, I mean, I was, you want me to just pull it up while Gail is trying to
Yeah,
get logged in
please.
here?
Yeah, pull it up.
Can you guys see this?
Yeah,
There you go. So I think it's good. It has a lot of good info. It's just maybe a little wordy.
Take you about 2 or 3 minutes to read it.
Yep.
yeah.
So I think it just needs to be trimmed up.
Yeah, each one of those little paragraphs can be shortened substantially.
Yep, and we put on your QR code, John, as you suggested.
I do remember seeing this now.
Well, so maybe let me propose that Jason, Gale, and I work on editing this, on trimming it to the most essential items and pass it around and for your comments.
I would say trim it and print it.
No pun intended, but use your Occam's razor.
Ah, that's a good callback to the barber shave. Thank you.
I mean, getting vaccinated is probably our number one piece of this, right?
Yep.
Yeah, yes.
So
Steve, that was really bad. Um,
yeah, so I mean,
mean-
we'll tighten it up as long as we're all in agreement. This is the message we're trying to get across here is all respiratory illnesses, and we're encouraging vaccination.
Yep.
and maybe this is an infographic. The way it is right now could be used if we want to have a handout to distribute here or there or whatever. Does that make sense?
Absolutely. Yeah, this could be used in a different format
Yeah.
for sure. Just not a
It's
not a
too much
banner
for
on
a
the corner, I don't
Yeah.
think.
Yep. All right, so we'll work on that and we'll pass around a new draft.
Sounds good.
Very good.
Yeah. I- If you shorten it, I mean, I think the message is easy enough. I would just, if you want to pass it around, that's great, but let's try to turn it around as fast as we can just so we can get it printed and put up.
Agreed.
What does it cost to get a banner printed these days?
Probably $100 to $200.
That's not bad. Good. Okay, so Gail, are you able to talk?
Sorry for all the technical difficulties. The last thing I wanted to ask the board about is purchasing mannequins for CPR. So I'm in the process of doing my final certification as an instructor, but in order to do it in the town and do it whenever people want to get certified in CPR, I have to borrow mannequins from Medfield or Needham. But it would be nice to have our own set of adult, child, and infant mannequins to be able to do trainings in Dover. So the cost is around $1,000.
Each,
And that's
right?
Is it 1,000 for the set of 3?
2 adult, 1 child, 1 infant.
Okay.
The masks, an AED to demonstrate how to use the AED with it, and storage of them. So, and these mannequins are biofeedback, so they light up to show the correct, rate of compression and everything.
So it's 1,000 for 4. That's pretty good.
Yeah.
So, what do you all think?
Sure. I doubt.
Seems like a
I
good
doubt-
investment.
Yeah, and it's also the state of the art seems to have improved beyond that of 20 years ago, where just by outside possibility, we might have found mannequins in the trailer, but probably not that give any sort of feedback.
Right. Great,
All right, I think that sounds great.
great. Thank you.
What are you getting? Fixed masks, disposable masks?
We're showing them the masks and how to
Okay.
use them. And I can also order pocket masks if people want to take them with them too.
Yeah.
So,
I mean, those are relatively inexpensive.
right. Interestingly enough, I ran into the Dover resident today that I did the hands-only training, the one who survived cardiac arrest. I saw her at Volantes this afternoon, and she asked me just about trainings and what's going to be going on this year. So she's interested in participating more because, as I've said before, she was a very compelling speaker to introduce the whole need for CPR training.
That's great.
That's it for me.
All right,
Thank you, Gail.
Thank you.
thank you very much.
Sorry for the headache.
All righty, so any questions for Gail before we move on? Maybe next time you could talk about blood pressure. You want to do that? Put that on the agenda?
We can include it in the nurse report.
Definitely.
Yeah, okay, good. All right, let's move on to emergency preparedness. Jason and Gail both attended this event, but which of you wants to talk?
Yeah, so I can start us off. So we haven't talked much about it amongst the group here, but Gail and I have been working a little bit on some emergency preparedness stuff over the last few months. Gail goes to our what are they technically called? The meetings that you go to, Gail? Is it our
It's DPH emergency preparedness. So it's with all the cities and towns in the Boston area. It's all over the place.
Yeah, so I
It's
kind of
Region
considered
4B, 4AB, I think it is.
Yes, thank you. That's what I was looking for.
Yeah.
So I kind of consider Gail our emergency preparedness coordinator, if you will. So what we did is we kind of dusted off our old plans, started to work a little bit on those. And I think it was 2-3 weeks ago at this point, Gail and I went to a tabletop exercise in Framingham. It was myself, Gail, police chief, and fire chief. And I don't know how else to say it other than it was great. They gave us actual real world scenarios, and we had to figure it out amongst our groups, our specific Dover group. So it was Gail and I bouncing ideas off of fire and police chiefs, and just generated some really good discussions, and kind of just got us thinking about some things we could be working on. And so I guess from here, this has kind of led us to, we're planning on having a meeting here in a couple of weeks with police chief and fire chief to get a little bit more into the emergency preparedness plans. I believe we're meeting at one of the schools. That's not official yet, so definitely don't quote me. But a point is, we're really kind of making strides here. I want to make sure we're dialed into where we need to be with our plans. I know it's not something I've spent a considerable amount of time on since I've been here. Our plans still had beeper numbers in them, which I'm sure I mentioned to you guys before. So that's obviously something we had to change. So that's kind of where we're at, just looking to kind of give these an overhaul and make sure we're in sync with the new police chief and fire chief. Gail, anything you want to add to that?
Yeah. So to prepare for this meeting, there was a document that the state required all the cities and towns to put in demographic and just it was kind of like a plug and play document of 70 pages where I would put in just characteristics about Dover, the population size, contacts, Jason, police chief, fire chief, basic information, but that's required at the state level. It doesn't supersede what our own internal plan is. But as Jason said, the real case scenarios they gave us to work out highlighted the fact that we have to look carefully and consider, if we had to do something like a shelter for an emergency situation, where would we shelter residents if there was some catastrophic event that took out, shelter for people, where would we go? So we're just, talking about that. And that's something Sherburne would like to partner with us on too. And so we're engaging fire and police in Sherburne also to look at options for that.
That is really great. I haven't heard in recent years anything about emergency planning that's that specific. And it has involved such a multidisciplinary group in Dover. I'm sure, Steve, you may remember some in the past, but there really hasn't been anything recently. It's great.
And I can't say enough great things about the police chief and fire chief. They've really kind of led the charge on this. We really couldn't do it without their support. As you know, something like this is a group effort. So really appreciate the partnership with them. And actually, the fire chief I talked to earlier today, we were talking a little bit about our storage trailer that we have. He's actually interested in having us park that over in the fire department parking lot, so they can kind of keep tabs on it and kind of help us out with that whole thing, which I think is a great idea. But I wanted to run that by you guys before we decided on anything.
I think the current location is kind of in the boondocks relative to the town hall. And
Well, then I said to the chief today, I said, what if we had needed it for this past snowstorm?
yeah,
Can't
Right.
access it.
couldn't even open the door probably.
No.
It seems like a good idea to me. Steve and John, what do you think?
Makes sense to me.
Many years ago, maybe as many as 10, if it was moved from another location, which I vaguely remember it being around the fire department. So it's come back to roost.
It was banished and now it's
Yeah.
back.
Just to get it up to date. That's
Yeah.
the main thing.
Yeah, no, it'd just be really nice to have it accessible, have it in a nice central location. Honestly, just to be able to drive by and see it, see Dover Board of Health on the side of that thing and know that it's there.
Yeah.
I just think there's a lot of nice benefits to that.
Well, this is also a sign that we have collaboration from emergency services in town. That is great. And I'm glad to hear that there's talk about collaboration between Dover and Sherburne, given the schools and the joint facilities that the towns own and Gail's role in both towns. I think it makes sense.
Agreed.
Any other questions about this? About emergency planning? Okay, so Jason, you're done with that, right?
Yep.
Okay. So we've talked about number 7. Well, we didn't talk about the newspaper. Jason, did you want to discuss something further number 7, you mentioned newspaper.
Yeah, and actually, I want to make sure to give Steve credit for this one because this was one of his ideas. He brought to me an article, and I'm sorry, Steve, I don't know what the name of that paper was because that wasn't Hometown, right?
It
Uh,
might have been the Milton Times.
Gotcha. Well, so anyway, so their Board of Health puts out monthly messaging with just updates of happenings in their department, which I thought was really cool. I didn't know if that was something that was of interest to this group. And so we found out too that article is actually done by the actual board, not the staff. I'm not saying we would have to do that same format because I feel like that's a big ask of you guys, but maybe something along those lines I don't think is a bad idea. Just putting out something occasionally with just Dover Board of Health updates.
And would you imagine doing that in the Hometown Weekly?
Yes.
As long as they don't charge for it.
Yeah. Anyone have any connections to people there to find out who we should ask?
If you walk in, they'll swamp you because they think you're about to buy an ad.
Where are
Well,
they
and if they
located?
don't want to do it, we also get that Stroll magazine every month.
Yeah.
Oh yeah, that's a good thought.
And Stroll needs content,
Yeah.
and we'd be in color.
Yeah, it's a little fancier.
Steve, they might want to photograph your cat.
Yeah.
Oh, John, you have a cat too.
They
We
have 2
Oh.
cats.
So I will tell you that the cat passed away a month ago.
Oh, I'm sorry,
Oh
Steve.
no,
Sorry.
sorry, Steve.
Oh,
How old was he or she?
17.
Yeah, we were
But,
wanting
but,
6.
but at least he's recorded for posterity in the form of these meetings.
Yeah,
yes.
yeah, that's a good point.
Yeah.
He actually tried to steal the show many times. Sophia, probably, did you ever see the cat in the meetings?
I think a couple times, yeah.
Yeah, he's been recorded on a set of minutes or two, I think.
Oh.
Had to have been.
In the
was
public
sometimes hard
comment
to-
section, right?
Sometimes hard to maintain your composure when the cat is standing up between Steve and the screen. Anyway, well, I'm sorry, Steve. But to get back to messaging, both would be, I mean, conceivably we could write one update and get it published in both venues, right?
I
They
think
may not want to see it published in both.
Yeah. So where would you what would you favor first?
the one that's read more.
Exactly.
And what do you think of what's the answer to that? Which one?
I don't know. I don't know anybody who reads the Stroll. And even though it's got interesting stuff in it.
So I read through it.
I do too. I read through both.
Yeah.
I think that the Hometown Weekly really wants for it needs more substantive content. I mean, both of them could use more substantive content, but Hometown Weekly is usually pets and sports. I'm not saying those aren't substantive, but they could use more. I don't know. What do you think?
I think the Hometown Weekly is more relevant in its own way, is the way it encompasses more topics regarding the area.
Yeah.
And it's not a social event we're going to be espousing. It's something that's serious.
Yeah. John, are you okay with that?
Yeah, that sounds
Focusing on
good to
Hometown
me.
Weekly? Okay. Um, and these could, the content could overlap with what we publish in the town newsletter each month too.
Yeah.
Okay, enough on that?
Yeah.
Anybody else? Okay, let's move on to number 8, associate board member warrant, the draft for the warrant. I looked at this and I would like to propose that we not require a unanimous vote about the associate board member. I'm of the opinion that that would hamstring us needlessly. We don't require unanimous votes about anything else. And if we needed to have an associate board member suddenly become a temporary acting voting member in the absence of one of us, I think it would make it even harder for us to have to require that the vote be unanimous. Anyway,
I strongly disagree. I think having a non-unanimous vote perpetuates a philosophy without necessarily reflecting the general will of the town. I suspect that it may have a problem at the warrant committee, and it will certainly have a problem at the town meeting if that's the way we go.
Why do you think this would be problematic at the town meeting?
Because that means that two people who have a certain political persuasion would always have the right to promote someone else with the same political persuasion.
You know,
Listen, if you let's face it, you're both members of the Democratic Town Committee.
yeah, but this is not a political, I mean, this board
It
isn't
turned
political.
political in the last few years.
I don't know. I would I would tend to disagree with that. You know, we don't run on partisan tickets for the board. You know, we're running as members of the town. We're not nominated to run for particular parties or because of any party affiliation.
Before you two, there wasn't anyone who was affiliated with a party as a member of the board as strongly as you two are. There was no partisanship regarding nomination of people to the board. And it's changed. And I'm trying to keep it a centrist organization such that it has greater acceptance amongst the townspeople.
I I think you're actually, Steve, promoting partisanship by making this an issue, and I don't like that. I mean, I don't bring my political views to the Board of Health,
Oh, so
and
generational tobacco wasn't a political view?
it's not a political view, Steve.
It wasn't
It-
for me.
It was viewed by a number of people as a political view.
Well,
Well,
you know
I
what,
didn't hear
Steve?
from.
I also support vaccination. Do you think that's a political view?
Not as severe as generational tobacco.
I see. Um, I I I think it's wrong for you to make a deal out of this, and I think to require that we have a unanimous vote about just this one thing has the potential to make it really difficult for the Board of Health in what might be a time of relative crisis for us if one of us was unable to serve suddenly.
And you remember, it would only be in the short term until there was an election to get a full board member and replace whoever had to step down, right?
Yeah, I think
Well,
that's a very important point.
I think you folks know that anyone who has an interim position has a far greater likelihood of being elected to a full-time position.
So
Out of
Steve,
town.
that's the rationale for having an associate position, whether it's elected or appointed, because
Yeah.
it's so hard to recruit people to town boards and committees. And the goal is to make it easier for somebody, not more difficult for somebody to join the Board of Health.
Well, I don't think we've made a great effort to recruit someone to be interested in joining the Board of Health. So that could be realized and amplified some. Secondly, I just have this view and I'm going to pursue it.
All right. Well,
You
go
know,
ahead,
Kate,
Tom.
I would agree with you. I think, I understand Steve's concern. I will say I don't share this concern. I would be happy to have, you know, since 99% of the decisions we make are really, I don't see any of them really having a political bent to them. Steve sees one that we've made over the last few years. You know, it doesn't seem like a major concern, especially given what we've done, the mission. I mean, yeah, hiring Jason, getting Gail hired by the town. I mean, these are all things that benefit all of us and really don't have, yeah, any kind of political philosophy behind it other than we want to try to do what's right for public health in our town.
I would agree with that.
No,
So, how do we move forward? I'm thinking that we should do a different draft that does not require a unanimous vote and bring it back to us. I think we have plenty of time to do that, right, Jason? To bring it back to a meeting, or I guess if we have a deadline from the warrant committee that's before our next meeting, Jason could circulate it to all of us, correct?
Yeah, I don't know the exact dates. I wouldn't say we have forever, so we should try and be swift about it.
Okay,
But I mean, you guys have all seen the draft. It's not like it's some multi-page thing that we have to go through. We're really only talking a couple sentences here, so all we have to
Can you
do.
pull it up?
Yeah, actually, do you mind, Sophia? Can you pull that up?
oh yeah, so what you're suggesting, John, is maybe we could take care of it now.
Yeah,
That'd be great.
Justin's right. It's really short.
Yeah, it is.
And the thing I'll point out, Steve, is that you might want to reach out to the warrant committee if you feel strongly about it, and just write an argument for, voting no or amending it.
I reserve the right to do so. I'm sure Kay's husband would love to hear my argument.
But what would go in the warrant, because there are always arguments in favor and against most of the things that are in the warrant,
So we
at
have
least amending bylaws.
we have specific or we have what's the word, liaison to the Board of Health from the warrant committee. Jason, it's not Simone anymore. It's do you remember the name?
I actually don't know if we ever got assigned a new one.
Well, there were initially two. We were assigned Simone and another person whose name I'm
Oh, was it
forgetting.
Sarah?
Yes, Sarah, that's it. And so Steve could contact Sarah we haven't spoken with Sarah. She hasn't reached out to us since they were going to meet with us and then they canceled the meeting because of a conflict. So that needs to be rescheduled. Maybe we should reach out and then we could let them know that Steve would be reaching out as well.
Yeah. So I don't know if everybody's had a chance to reread this, but
No.
I would move that we approve forwarding this to the warrant committee, subject to replacing the word unanimous with majority in the boldface paragraph on the bottom where it would read, upon designation by a majority vote of the board, the associate member may act as a full member of the board, etc.
Can I raise something else? I
Sure.
mean, let's say that one of us suddenly died, right? You can't have them if you're left with two members, you can't have a majority unless things are unanimous, right?
That is
I'm sorry to
true
be so
too.
morbid, but uh does that I think that's fine, right? I mean, so we'd have a majority vote, and if the two members of the board disagreed, then
Then they'd have to find a compromise individual.
yeah. All right. So we don't so a majority vote makes sense.
Yep, that's a really good point, Kay.
I have no
I guess
plans.
I'll mention too while we're looking at this. One thing that crossed my mind when I first read this. So the way this is written with the vote, upon designation by unanimous vote of the board, the associate member may act as a full member. So I kind of read that as this vote is applying only to giving that person voting power, not necessarily the initial appointment. Do you guys get what I mean?
Yep. Yep.
Now, I this could just be my interpretation of it. Maybe you guys feel differently, but I did at least want to mention it because it was something that jumped out to me.
I
Could you
interpret
repeat that again? I'm trying to piece this together.
So I read this as the unanimous vote is only coming into play to give the associate member voting privileges, not the initial appointment. The appointment does not mention a vote.
it just says the initial appointment is an appointment. The Board of Health may appoint an associate member to the Board of Health, which uh would mean that by majority vote. That's that that's what my interpretation of that is. But then the next sentence is the one that addresses appointing that person to be a temporary active member, voting member, and what we'd said is that would be by unanimous vote.
By majority vote.
We were going to change it to majority vote. Yes.
Right.
From unanimous to majority vote.
But so what you're saying, Kay, is the fact that it only says appoint and doesn't give actual voting language, that the default would just be majority.
Yeah.
Makes sense. I just thought I would flag it because it was something that jumped out to me.
I mean, we don't even have to say majority vote. We could just say upon vote of the board, the associate member may act as a full member of the board in the event of a conflict, right?
Yep, that makes sense. Because you're right. With two members, it's going to have to be a consensus.
Yeah.
All right, so I move that we amend this to remove the word unanimous and forward it to the warrant committee for consideration for the warrant for this year's town meeting.
I second.
So I, John Quackenbush.
I, Kay Peterson.
No, Stephen Crestcall.
All right, so we can, we'll do a new draft and then we should send it back to Martell and Nina, right, Jason?
That would be my plan, yes, since that draft came directly from Martel.
Yeah.
Just to make sure they're aware of that change.
Okay. All right. Anything else about that before we move to the next topic? Then let's move to number 9, waste management. Steve, I think that's,
Nothing new. I think the weather's been too inclement to pursue whether single stream recycling is actually being done by our private trash haulers. But I did speak as recently as yesterday with Jennifer regarding the fact that the recycling is still on board and making sure that our trash haulers are actually single stream recycling rather than combining trash and recyclables.
mhm.
They're still interested in seeing if that's actually what's going on.
Okay, I don't have any questions about that. John, do you?
No. Thanks for doing that, Steve.
Do we have any other topics to discuss?
I have a few just like quick updates for old business, unless someone else has something first.
No, go ahead, Steve. I mean, Jason.
I was just going to mention that course you sent around today too.
Yes, thank you. That was one of my items actually.
Okay, that didn't sound like old business, so please go ahead.
Well, I guess old business in the sense that I've talked about it with you guys previously.
Okay.
Yeah, so John mentioned I had shared that training with all you guys, the MAHB, specifically for Board of Health members. If any of you guys are interested in attending. Only bummer, I guess, is all the training days are Saturdays. Which is what it is. I think it's a good opportunity for board members. So if you guys are interested in specific dates, just let me know and we can get you signed up. It's all paid for by the shared services. So,
Well, if you read the bottom of the flyer too, and I don't know when this takes effect, but it says that Board of Health, even elected members, are going to be required to have training. And it doesn't say explicitly, but it suggests that this training would actually be, training that would be, it would satisfy that requirement.
That would be correct, right, Jason? That doing this.
yeah, technically, it's just, I guess, to John's point, I don't know. I don't know how loosely that requirement is being applied. Like, yeah, you guys probably should do it, but in terms of not doing it, I don't know what that actually means. Go ahead, Steve.
If they're concerned about participation by our citizenry, to have a mandated requirement such as that will diminish the probability of that someone wants to be a member of the Board of Health. So my guess is it shouldn't fly.
If it's a state law, it's a state law. There's not too much we can do about it.
Yeah, but they don't understand what fallout will be.
No good deed goes unpunished, Steve.
And what if 2 of us or 3 of us all go to the same course? We then have to
Don't
just
sit
have to be
together.
careful. Don't sit together, right? Well, all right, so we'll let you know, Jason.
Please.
Okay, good. Thank you for bringing that up.
You can thank John.
Thank you, John.
I'm going to the one I told Jason, I think it's on the 11th of April
Yep.
because it's the closest and it's the only day that works for me. So if anybody else wants to go and sit a few seats away from me, you're more than welcome. Maybe we can even carpool there.
Actually, that would be tough, right? Arriving in the car together. Not a good look, but it would
Oh
be
my
great to
God, to go
carpool.
for training, that's just ridiculous.
Yeah. So, will Cheryl Sabara be doing a lot of this? Jason, do you think?
I believe so. And if you've ever been through a training with her, it's fantastic. She's tops in terms of public health,
She really is great.
law in Massachusetts.
She really knows her stuff and she's a great speaker. So any other topics, Jason?
Yeah, I just wanted to mention I did end up meeting with the gentleman from Nantucket about PFAS. Had a really great meeting with him. Kind of feel a lot better about our situation. They require PFAS testing for all new wells and property transfers. So I think my plan is to start taking some more steps with that. Andrew was really helpful, and he's available just if we do have any questions. Quick FOIA. Go ahead.
Can you just relay what he said about how many properties they've had with problems? I think you said that very few, right, with very high levels on Nantucket.
So great question. Yes, very few. And also they've done this for a couple of years and the response that they've gotten has been overwhelmingly positive.
So they didn't get pushback from the real estate people?
No.
Great.
And so, we talked about this a little bit last time. One of my plan would be to reach out to all our stakeholders, our realtors, our well companies, just to get feedback from those folks, the ones who are going to be dealing with this directly.
I did reach out to one realtor, somebody who was a former neighbor who said she didn't see any problems with it. But that's an N of one.
Anything else on that?
No, thank you for talking with him.
Yeah, no, it was great getting to catch up with him. He's a tremendous resource. FOIA update. As you guys know, we've been working on that big FOIA request, taking a lot longer than originally anticipated. But my plan is to kind of have it wrapped up this week. So what I'm asking of the board at this point, please share with me anything you may not have shared with me at this point, meaning any text messages that may apply, any emails on personal accounts, anything like that. Just kind of putting out a last call for that is all, just to make sure we have everything. Steve, go ahead.
Jason, have the other two board members given you their texts, if there are any relevant texts?
Good question. I have not received any, which is one of the reasons why I'm just putting out the last call right now, just so we can make sure we have everything before we submit it. It is going to go to town council first, just so they can get eyes on things and see if anything needs to be redacted or excluded. Which there will be, just because we have come across some random things where it's like, there's a password on something that shouldn't be there that isn't public information, and things like that just obviously you would exclude. So the plan is to just get it wrapped up this week, because it's kind of just been looming over us. So just want to be able to wrap it up and move on. I've had the entire staff working on it.
So I have a couple of questions. As I told you a while back, I started by searching on the word nicotine, and I came up with hundreds of emails that contain the word nicotine, partly because I subscribe to some newsletters that are related to public health, and nicotine comes up a lot. And I interpret the FOIA request as asking for everything that has the word nicotine in it, every email and text message that has nicotine in it, and that searching on, say, narrowing the search to nicotine-free generation would be too narrow for this. And and then I'm not sure how what the most efficient way is to collate those hundreds of emails and get them to you, Jason. And maybe you and I can just talk about that on Wednesday when we meet. But I tried to you saw that email that I sent you, and I tried to send a bunch of them, and it was very time consuming to get them into the email. And there must be something. I mean, I struggle with things like this, and I am not a digital enough. I'm not a native to this enough that I can just automatically do it. Do any of you have any suggestions for how to put all these emails into a document that I can send to Jason? And also, are you also interpreting this as looking for every email in your that has the word nicotine in it, as an example?
I actually, Kay, I don't believe that is correct. I don't know that nicotine on its own is one of the trigger words.
Is that right?
Yeah. So it's very specific phrases that we're pulling. I think in terms of nicotine, the expression that you're looking for is nicotine free.
Well,
Okay.
I mean, yeah, I don't have any emails that mention nicotine-free anything other than what's gone through my town Gmail account. So once that was set up, I tried to make sure I didn't use I don't use any other email account I have, and I have at least 3 or 4 others, um, for any town business at all.
Jason, could you ask the other 2 members whether they also checked their texts?
I can look for nicotine-free.
I haven't checked my text yet because I got so overwhelmed with what I just described to you. I'm going to check my text, but did you find anything in your text, Steve?
No, I looked.
Actually, the text search I found to be the easiest, because if you
Yeah.
haven't, at least for iPhone anyway, you can just search within all your messages
Yeah.
and you just plug in the trigger words.
So what did you do, Steve and John, to send your the emails that were relevant to Jason? Did you just forward them
I did.
individually?
Jason got a data dump.
But did you
Yeah.
do them one by one?
Yes,
And about how many did you have to send?
not a lot, because it wasn't part of the discussion with either of you folks or with the people who were lobbying, but I did send everything the lobbyist sent.
So
Yeah,
I would have thought the town would just pull those.
Also, I guess keep this in mind. if you had an exchange on your personal email account with a town email address, that email will be pulled automatically. So what we're focusing on here for the personal accounts is exchanges that took place outside of the town domain. Do you know what I mean?
Oh, okay.
So, okay, like for example, if you have emails on your personal account that went to my town email address, they're being pulled automatically.
So I don't have to worry about those.
You don't have to do
Okay.
anything with those.
All right, all right, all right. That's going to change things. So I use my town email account most of the time, but some people email me on my Gmail account, and so I have to search both. Jason, maybe I'll talk to you on Wednesday about the details of this search.
Sounds like a plan.
All right.
Anything else on the FOIA request?
No, the only thing I found in my Gmail account was Mary and I went to a play at the Huntington Theater, and in it says it's 100% nicotine-free event. No, actually, they were on stage. They were smoking, and it's cocoa shell cigarettes, which are 100% nicotine-free. There we go.
Well, there's a little interesting bit of culture.
Yeah, everything else is Dover, so I think I'm set.
Can I ask if you're trying to search in your email for nicotine free, 2 words, but together like that, do you put them between quotation marks, and does that do it?
It should. There's also everything I looked for was nicotine hyphen free. I can
Yeah,
Just
that
put in the
does-
2 words nicotine and free
Yeah,
without
but
any diacritical marks whatsoever.
but then, oh, I see, you put in both of them.
On the search bar, just put in those 2 words.
Yeah, and then they're both required of
Yeah,
the search. I
Yeah.
see. Yeah. Okay.
Yeah, the email client I use, if I put them in without the quotations, it pulls up everything that has nicotine. It's an or search. It's not an and search, it's an or search.
Mm.
So nicotine or free.
If you do it without quotations.
That the email client I use, so I don't
see.
use
You don't
the
use
Gmail
Gmail.
client. No.
Okay.
But again, I think it's all there's lots of free stuff that shows up.
All right. I'll work on this. I don't mean to slow us down with that. Jason, you have more?
Just the last thing I have is FY27 budget. We already kind of wrapped up on our end here. But I just wanted to let the group know that I'll be presenting that to warrant committee next Monday evening. So I'll have a PowerPoint that I'll prepare for that. Very basic, just kind of going through our plans for FY27.
Great.
Anybody else have any old business? I kind of blew up the spot there, so I apologize.
The 40B on Strawberry Hill Street, there's an email from the town administrator about it, but I haven't had a chance to read it yet.
Yeah, so Mike put all the comments together and submitted those. That's what that was. It's the formal letter.
Is that comment that Mike submitted regarding our Board of Health word for word what we submitted?
Pretty much, yeah.
It seems heavily edited. beyond our capabilities, and it looks as though it was also edited by legal people as well.
I mean, town council did have their hands on it, so they may have changed some things, but I looked it over. It was, I mean, the comment sheet I submitted was attached, verbatim, exactly how I had it. And everything in the body of the letter looked fine to me. Was there anything specific?
No, I was just wondering if it was
Yeah.
something that we submitted and was not edited or was edited, pure and simple.
Yeah, it looked mostly intact from what I saw, so I don't know that anything changed. And I apologize, John. By the time I got your comments, we were already past due date, so they didn't make it on. But I think your comments were mostly in sync with the rest of us, so
Yeah, that's
wasn't
fine.
really anything.
That's my fault, so don't apologize. Thank you for doing it.
But yeah, so I guess we'll see what happens on that. Thank you for bringing it up, Kay. I don't know how much our comments really matter at this stage of this process. But nonetheless, we got our voices out there, and we'll see what happens in the latter stages of this. Go ahead, Steve.
So regarding the paragraph which contains our commentary, are we subject to subsequent discussion with the state regarding our comments?
What do you mean by that question? Can you
Yeah, I don't really
rephrase?
Can the state ask us to elaborate further regarding our comments? And just how would they do that?
I think it's not, I'm not an expert in 40B, but I'm pretty sure that we don't really play a role with the state so much as with the zoning board of appeals. But I suppose someone at the state could reach out to us if they wanted. I mean, what, no one's forbidden from talking to somebody else, I guess. But the standard process is that we will submit our concerns, requests, whatever, to the ZBA, and then they'll manage the communication with the state at this point. If the developer submits a comprehensive permit application, that's really the next step.
So I'm not 100% sure that I read that correctly. It looked as though its format suggested it was going directly to the state.
The comments that,
Yes.
yes, those comments went to the state. They went to
Okay.
to Mass Housing. But after this, first of all, Jason's right, that Mass Housing is not really interested in our comments. We're allowed to make them, but they're not going to engage with them because their job is really just to determine whether the site is suitable in a sort of writ large way, I think. Is it big enough? Is it, I don't know what all the criteria are, but
So if we were to get a phone call from a Globe reporter regarding our comments and something that we've submitted to the state, such as that, we should refer them to you.
I'm not, I don't really
I think-
understand.
I think-
feel
I
like
think-
you're trying to send me a message and I'm not getting it.
I think that those comments could be taken in such a way that certain periodicals that have an agenda regarding this might reach out to us to elaborate further.
Hmm.
I wouldn't be surprised. Dover's a punching bag.
We certainly are.
I mean, the truth is, I mean, there's probably a 99% chance those comments will not even be read. I mean, that's just the truth. Mass Housing just they look for anything they can get just in terms of getting these housing developments out there. That's the main driver for them, of course. These comments were just an opportunity for us to voice our opinions at this point in the game. They're really not going to matter or really come into play. Not at this point anyway. We'll still have our opportunities for review and making sure the applicant is compliant with all the different regs and all those things. So this is just one small piece of that process.
Alrighty. Does anyone have any other issue they want to bring up?
All right, well,
Then,
nice seeing you all.
Yeah,
Enjoy your
nice seeing you.
evening.
Can I have a motion to adjourn?
I move we adjourn.
Second,
All in favor? Aye, Kay Peterson.
Hi, John Quackenbush.
I, Stephen Crosscall.
Gail, Jason, Sophia, thank you all so much.
Our pleasure. Thank you guys.
Thank you.
Good
Thanks.
job.
Okay.
Take care.
See you
Good night, everybody.
Have a good
next
night.
month, if not sooner.